Vasodilators in hypertension. Here's one of the most surprising stories in pharmacology. A drug developed to treat severe hypertension became one of the world's most popular treatments for hair loss. Another drug can lower dangerously high blood pressure within minutes, but must be used only under intensive monitoring because prolonged use can cause cyanide toxicity. And a third remains an important drug for severe hypertension during pregnancy. How can drugs with such different clinical roles belong to the same class? In this video, we'll explore the fascinating pharmacology of the vasodilators used in hypertension. What are vasodilators? Vasodilators relax vascular smooth muscle, causing mainly arteriolar dilation. This reduces peripheral vascular resistance, afterload, which lowers blood pressure. Drug-specific mechanisms. Let's begin with hydralazine. Hydralazine increases nitric oxide release from the vascular endothelium. Nitric oxide then activates guanylyl cyclase, leading to an increase in cyclic GMP or cGMP inside vascular smooth muscle cells. Elevated cGMP reduces intracellular calcium, producing smooth muscle relaxation, particularly in arterioles. This decreases peripheral vascular resistance and lowers blood pressure. Next is minoxidil. Unlike hydralazine, minoxidil does not work through nitric oxide. Instead, it opens ATP-sensitive potassium channels in vascular smooth muscle. Potassium leaves the cell, causing hyperpolarization of the cell membrane. Hyperpolarization prevents calcium entry through voltage-gated calcium channels, resulting in smooth muscle relaxation and marked arteriolar vasodilation. Because it is an extremely potent vasodilator, minoxidil is generally reserved for severe or resistant hypertension. Finally, sodium nitroprusside acts by a different mechanism. It releases nitric oxide directly, producing a rapid rise in cGMP within vascular smooth muscle. This causes potent arterial as well as venous dilatation, making sodium nitroprusside unique among these drugs. Arteriolar dilatation reduces afterload, while venous dilatation decreases preload. This dual action explains why it is the drug of choice for hypertensive emergencies, where blood pressure must be lowered rapidly under continuous monitoring. Clinical uses. The first and most important indication is hypertensive emergencies. In this life-threatening condition, blood pressure must be lowered rapidly but in a controlled manner to prevent damage to vital organs such as the brain, heart, and kidneys. Sodium nitroprusside, administered intravenously, provides rapid, potent control of blood pressure because it acts within seconds and can be precisely titrated. The next indication is resistant hypertension. This refers to hypertension that remains uncontrolled despite the use of 3 or more antihypertensive drugs at optimal doses. In such patients, hydralazine or minoxidil may be added as add-on agents. Another important use is hypertension in pregnancy. Intravenous hydralazine has long been a commonly preferred drug for the acute management of severe hypertension during pregnancy because of its effectiveness and established safety profile for both the mother and the fetus. Finally, in heart failure, particularly selected patients with heart failure with reduced ejection fraction, hydralazine is often combined with nitrates. Hydralazine reduces afterload by dilating arterioles, while nitrates reduce preload by dilating veins. The Minoxidil story. Minoxidil was introduced as a powerful vasodilator for resistant hypertension. Physicians noticed patients developing hypertrichosis, excessive hair growth. This unexpected adverse effect was transformed into a therapeutic benefit. Today, topical minoxidil is widely used for androgenetic alopecia. Adverse effects. An important concept to remember is that most adverse effects result from excessive vasodilation and reflex sympathetic activation. The first adverse effect is reflex tachycardia and palpitations. When blood pressure falls rapidly, the baroreceptor reflex activates the sympathetic nervous system. This sympathetic activation in response to the blood pressure drop increases heart rate and myocardial contractility, producing tachycardia and a sensation of palpitations. To counteract this, vasodilators are often prescribed together with a beta blocker. The second common adverse effect is headache and flushing. These occur as a direct result of vasodilation, particularly of cutaneous and cerebral blood vessels. Although usually mild and transient, they are among the most frequent reasons patients complain after starting therapy. Another important adverse effect is sodium and water retention. Vasodilation activates compensatory mechanisms such as the renin-angiotensin-aldosterone system. This causes the kidneys to retain sodium and water, leading to edema. Therefore, these drugs often require a diuretic to prevent fluid retention. Drug-specific effects. Let's begin with hydralazine. With long-term use, hydralazine may produce a lupus-like syndrome. Patients can develop symptoms such as fever, joint pain, muscle pain, and a positive anti-nuclear antibody test. Unlike true systemic lupus erythematosus, these symptoms usually improve after discontinuing the drug. Therefore, this is an important complication to remember in patients receiving prolonged hydralazine therapy. Next is minoxidil. Its characteristic adverse effect is hypertrichosis, which means excess hair growth. Hair growth may occur on the face, arms, and other parts of the body. Although this side effect is undesirable when minoxidil is used for hypertension, it led to an interesting clinical application. Today, topical minoxidil is widely used for the treatment of androgenetic alopecia, or male and female pattern hair loss. Finally, sodium nitroprusside can cause cyanide toxicity with prolonged infusion, particularly when administered at high doses or for extended periods. Cyanide inhibits cellular respiration, making this a potentially life-threatening complication. Therefore, sodium nitroprusside should be used only with intensive monitoring, and prolonged infusions should be avoided whenever possible. Key takeaways. Before we conclude, let's quickly summarize the key takeaways from this topic. First, remember the shared mechanism. All three relax arteriolar smooth muscle, thereby reducing peripheral vascular resistance, which ultimately lowers blood pressure. Second, always choose the right drug for the right clinical setting. Sodium nitroprusside is the drug of choice for hypertensive emergencies because of its rapid intravenous action. Hydralazine is commonly preferred for severe hypertension in pregnancy, while minoxidil is reserved for resistant hypertension that remains uncontrolled despite conventional therapy. Third, remember the concept of repurposing in action. The adverse effect of hypertrichosis with minoxidil eventually became the basis for its use as a topical treatment for alopecia. This is a classic example of how an unwanted side effect can evolve into a valuable therapeutic application. Finally, always monitor adverse effects. Be prepared for reflex tachycardia, edema due to sodium and water retention, and the important drug-specific toxicities. Hydralazine can cause a lupus-like syndrome, minoxidil causes hypertrichosis, and prolonged sodium nitroprusside infusion may lead to cyanide toxicity.